Hello, Dr. Minkoff.
Hi, Michelle.
Can you talk to us about your philosophies about health?
Oh, that's a deep question. You know, I think that health is a do-it-yourself process. It's a matter of choices. You know, some people would rather have the sensation of being high, being drunk, being fat, being unfit than they would feeling vitality, be out of pain, have energy, being fit. You know, it is a choice. And I do respect people for the choices that they make. So if someone decides that they want to live shorter or spend their last years on medication or with doctors, and that's what they want, I'm fine with it. My personal philosophy is that if you treat the body well as a biological organism, you can keep it functioning better and longer because there's some sort of rules that go on with it. When I was in college, I took a yoga class from an old Swami, and he said, here's the rule on the body. The first 20 years of your life, you can do anything you want. The second 20 years of your life, you kind of can coast on grace. And the third 20 years of your life, your body will take you to hell. Now that was in the 1970s. What's occurred since between then and now is that you don't get 20 years and 20 years and 20 years. You probably don't get hardly any years. What we're finding now is because much of the food supply is toxic and the environment is toxic, that many pregnant women are toxic. And the best way to detoxify a pregnant woman is to get her pregnant, because what she will do is dump the toxins into the body of the baby. And when the baby's born, the baby will be toxic. And so we are now seeing diseases in children, diabetes, soaring cancer rates, soaring ADD rates, because these children are actually sick. This isn't psychological disease. This is sickness because these bodies are poisoned. And I think now, if you want health, if you want to be free of the medical system, that before you get pregnant, you have to fix yourself up. And that wherever you are on the spectrum, that you can reverse the process that's been going on in you. We live in a toxic environment. There's no getting around it. Even the polar bears are toxic. You know, they have PCBs in the polar bears, and they have bisphenol A and mercury and lead in the polar bears. So there's no getting away from it. But you can live a lifestyle where you can do better and where you can preserve your health. And so my philosophy is, if that's what you want, then you need somebody to help you do it, because it's a maze. If you go on the internet and you try to figure out what to do, you will just get confused, because 95% of it is misinformation. It isn't even right. When I started medical school, I had a professor. He said to me, on the first day of medical school, he stood up before us and he said, listen, their medical knowledge is doubling every 2 years. He said, what I can tell you is probably only 50% of what we teach you today will be true in 2 years. He said, the big problem is we don't know which 50% is the truth or the lie. And that is absolutely true. Most of what you read in the newspapers, read in medical journals, hear or read on the internet is false information. It's all a lie. It is being forced on you by somebody who has some other agenda. Be it a professor who needs publishing, being at a company that's going to make money. It's all agendized. And you have to be able to get out of that if you're going to get yourself healthy, because most of what you're being sold isn't true and doesn't work. And so part of the things that we do here is we try to educate people in what is actually true and what does work, and what is true does work. And if you're doing something and it's not working, it's not true. And so I think as you search for your own answers, there are some things that are true. One is, if you get into the medical system, your chances of getting harmed are very high. hundreds of thousands of people every year die from medical treatments. Not because doctors are bad people or they're trying to hurt people. It's just that the information is wrong, but it's being acted upon. Do low-fat diets prevent heart disease? No, they cause it. So the truth is what actually works, and what works you can get help with. There are medical professionals around like us that spend their lives trying to figure out what is actually true and what is not. And the answer is the patient is feeling better and does better and lives longer and gets off of medications and has more energy, and that's what we're looking for. And so in your pursuit of health, that's what's really important. And so I recommend that that's what you hold as your own standard, so that you can see if what you're doing is actually going to get you where you want to go.
Okay, thank you very much.